Right. The serratus anterior is one of your muscles that help in protraction of your scapula. So it involves your ribs, and it wraps around the ribs this way and attaches on the front end of your scapula. So if this is your scapula here, so it attaches underneath it like that.
Okay. And so it aids in protraction. What are common injuries in the serratus anterior?
Probably mostly strains. So it involves anything, uh, any type of overhead arm movement. When you have a lot of probably more of an overextension where it results in your scapular to wing. So when your scapula wings, is that when you're raising your arm up over your head like this, your scapula is supposed to move smoothly in this motion. So if it wings, when it's moving, it pops up like that.
Okay.
So usually that indicates a weakness in your serratus anterior.
What kind of rehab exercises would you do to correct that?
A lot of it has to do with anything that has to do with the rowing motion. Seated rows, a good one is the serratus punch, where you have your patient laying supine, arms at 90 degrees. They're punching up and then retracting that muscle back. So all the movements coming from back here. So push up and back down.
The serratus anterior muscle originates on the lateral aspect of ribs 1 through 8 and inserts on the medial border of the scapula. The muscle is innervated by the long thoracic nerve of the brachial plexus. The main function of the serratus anterior is protraction, with the synergist being the pectoralis minor, and the antagonists being the mid-traps and rhomboids. During protraction, the trapezius prevents downward rotation. Because the serratus anterior works for protraction, this aids in allowing overhead motion of the scapula and shoulder joints. Therefore, common injuries of the serratus anterior are strain and scapular winging. Scapular winging is a protrusion of the scapula caused by weakness in the serratus anterior. General strain of this muscle comes from the overuse of the muscle.
Our client, Jackson, is a 22-year-old left-handed pitcher. During his senior season, Jackson has begun experiencing shoulder pain. After an examination, it is believed that due to the amount of overhead activity from the throwing motion, Jackson has a strain in the serratus anterior. Therefore, we recommend that he begin a regimen of shoulder strengthening activities for both the rotator cuff and the serratus anterior. The two main exercises are modified scapular push-up on TRX bands and TheraBand scapular single arm punches.
Scapular push-up. This is a variation done with the client putting both feet into the TRX band. Since this is done in the prone position, the axis of motion is the transverse y-axis. Once the feet are placed into the band, the client engages the core and goes up into a push-up position. This push-up position should be gently slanted with feet slightly lower than the upper body. It is important to engage the core muscles during this exercise to ensure that the lower back does not slump. The downward motion is similar to that of a push-up. However, it is important that the client focuses on the forward rounding of the shoulder blades. This motion should be quite visible. Then, on the way back up into retraction, pulling the scapula towards the spine. During the downward protraction phase, the serratus anterior is activated and extends, creating an eccentric exercise, with the pectoralis minor acting as the synergist. On the upward retraction phase, the antagonists are the rhomboids and middle trapezius. This movement occurs in the scapulothoracic joint and the acromioclavicular joint. The TRX variation of this exercise is interesting because it recruits many other muscles to help with the stabilization of the core, such as the rectus abdominis, obliques, and erector spinae.
For the TheraBand single arm scapular punch, the setup is pretty straightforward. The client will stand with the TheraBand or resistance band behind them with a firm grasp on the end of the band. The arms will be raised to 90 degrees of flexion. Since the arms are flexed to 90, this motion will be occurring in the sagittal plane or the y-axis. There should be light resistance on the bands while standing still, but once the scapula goes into protraction phase, there should be enough resistance that the scapula can go into full protraction, but not so much that the client can no longer maintain good posture or feel as though the band is pulling them backwards. During the exercise, there will be the protraction phase, where the client will use one arm to stabilize the band and the other will go into full protraction. Then, the client will slowly go through the retraction phase of pinching the scapula towards the shoulder. During the protraction phase, the eccentric activity will occur in the serratus anterior, with the pectoralis minor acting as the cingulus, the shoulder that is not moving with the stabilized by the rotator cuff. During the retraction phase, the antagonists will be the rhomboids in the middle and upper trapezius.